with that. What about the using a DEXA for measurement of, you know, is that tied, bone loss and all that tied to thyroid disease? How does that correspond?
Well, it corresponds in that, you know, women are more commonly diagnosed with osteoporosis, though men do get osteoporosis as well, but because of the delicate hormonal balances in women, we tend to see osteoporosis more in women. So we screen women more frequently for osteoporosis, and the DEXA scan is the easiest way to screen for osteoporosis. It's a non-invasive test that uses very low energy X-rays, and we typically will scan the lumbar spine, the low back, and the hip, and sometimes the wrist. And it's a very simple test, takes about 20 minutes, and basically there are three results that we get from a DEXA scan. Normal bone mineral density, which means that the bone mineral density of the patient is the same or similar to an aged matched control population. The other possibility is osteoporosis, which is bone loss, meaning that there is a higher risk of fracture. And then there's a intermediate category, which is osteopenia, which is, you know, between normal and osteoporotic. And there is an increased risk of fracture for patients with osteopenia, but it is not as high as for patients who have osteoporosis. And typically women will get a baseline screening DEXA scan around menopause, around age 50. And then depending on the results of the DEXA scan, they may or may not get treated, or perhaps, you know, their physician may choose just dietary therapy, calcium, vitamin D, things like that. And we see women back, you know, a year to 2 years after their baseline DEXA scan to see how they're doing. Now, we don't necessarily look for improvements, and we'd like to see improvements, women going from osteoporotic to osteopenic to normal. However, sometimes we just would like to see bone mineral density maintained. That is, if a woman is osteopenic, if they come back,
lower.
Exactly. If they're still osteopenic, that's not necessarily a bad thing. It just maintains that that means that they're maintaining their bone mineral density and they're not losing more bone. Now, of course, we would like to see improvements from osteoporosis, but we don't necessarily always. It's not bad news if we don't see an improvement.